This segment of Delmarva Life is brought to you by Tidal Health.
You know, everything started coming back. Indoor events, summer carnivals, hugs. And then about halfway through the summer, we all had that deja vu moment.
Oh, yeah. COVID numbers steadily were decreasing, and then all of a sudden they started going back up again. We started seeing breakthrough infections among some vaccinated people. Now we're all wondering, what's going on?
Yeah.
What's next? Well, to give us some answers today, we have Tidal Health President and CEO Stephen Leonard. He joins us via Zoom this afternoon. Thank you so much for joining us, Steve.
Oh, thanks for having me. Appreciate the interest.
So let's start off by talking about what's going on at the hospital. What are the current conditions?
I think your intro was great. We were all feeling pretty good in the first half of the summer, and then our most recent surge. So we definitely have more patients. We're actually in the mid-40s here at Tidal Health Peninsula Regional, and in the teens up at Tidal Health Nanticoke. So approaching a little bit more than 60 at this point in time total patients. So it is definitely a surge. It is a little bit different than the past surges, but a surge nonetheless.
Yeah.
I was just about to ask, how does this third surge, it feels like, compare to those first two that we dealt with here on Delmarva last year?
The Delta variant is known to be more transmissive, although the acuity is a little bit less. So we don't see quite as many ICU patients as we did the first time, or the second time with the third surge. But at this point in time, I think we know how to manage it pretty well, but it is busy. To a large extent, the vast majority of folks who are in the hospital are unvaccinated individuals. So there's definitely still a strong message out there to get vaccinated. Yes, we've seen these breakthrough infections, as you say, but at the same time, those folks where that has occurred have had much more modest symptoms as compared to the folks who are unvaccinated, especially in the hospital.
Yeah, I'd like to kind of go back to that a little bit because, you know, I think there are some who think you get vaccinated, you don't get it, but you can, but it's not as bad, is it?
Sure. The evidence is indisputable that the COVID vaccines if you have them, you're protected against severe COVID, hospitalization, and death. Now, what we do know is they were always 90 to 95% effective, which means you could, even when they were in the first given, still get COVID. Some people don't have the same response, immunologically speaking, as others. I think what we're seeing over time is there is questions about long-term efficacy. And I think those are questions that are being asked, and that's why you're hearing conversations about booster shots at this point in time and really understanding, when and how to give those. And we are in the process of starting those as well. So you can still get it. And I think perhaps over time, they're showing that you can get it because efficacy may be going down. But at the same time, if you do, your body has that history. And like I said, the folks who have been vaccinated have a much more mild course of it, seemingly, than the folks who are unvaccinated, at least here at our system.
Absolutely. Okay, so another thing that a lot of people are talking about, masks, masks in schools, requiring children and staff to wear them. Can I just ask you your take on that?
As a parent or as a hospital administrator?
Both, actually.
Yeah, this is one where I would love to, I've told people many times through this pandemic, we would all love to fast forward 2 or 3 years and actually see what the evidence truly says, in mass, after a couple of years of this stuff. But we can't. So I think we have to take the best course of action that we think is reasonable and prudent. I will tell you from a hospital perspective, we do believe masks work when supporting and taking care of COVID patients. That's what we saw during the first few waves without a vaccine, that if you use personal protective equipment, you can keep the staff safe and keep patients safe as well. So when schools make decisions about masks, I can understand both cases, quite honestly. I think that, it is prudent and cautious to, some school districts have required them, some have highly encouraged them. It's a tough one, though, because I'm not sure there really is the perfect answer. I think having a mask on allows you to avoid certain exposures that may happen should you be near someone who is COVID positive, and that may be beneficial. or especially if you have pre-existing health-related conditions. I think that's very beneficial as well. For me as a parent, I definitely encourage vaccination. I think that's the best thing you can do. And then I think, follow the advice of your provider and what you feel is most safe for your child.
Where do you go to get a vaccine, and vaccination locations across Delmarva?
There are quite a few locations at this point in time. The county health departments, all the local pharmacies, even providers, physician offices have vaccines. We have our vaccination hotline. That number is 410-912-6968. We're getting ready to spin up another level of vaccinations. Looking at the hospital here, I could tell you definitely on Delmarva. I know a lot of folks, they want to hear about what's happening here. Talk to your doctor if you have questions. That's one of the best pieces of advice I think I could give. See if you have questions about safety, and people do. Talk to your provider. Talk to people you trust. Here at Tidal Health, I can tell you we see people in the hospital, and again, the vast majority of them who have more significant cases have been unvaccinated individuals. So they do work.
Yeah. Stephen Leonard, President and CEO, Tidal Health, thank you so much for taking some time with us this afternoon to talk about what everybody's talking about, COVID-19.
Thanks, Steve.
No, thank you. We appreciate it.